You'll never hear this at your doctor's office, but the single biggest reason men over 60 lose their sex life isn't low testosterone, it's something most men have never even heard of. What if the real issue isn't your heart, or your hormones, or even your age? Most men chalk it all up to getting older. But what if I told you there's a tiny set of muscles deep inside your body muscles you've probably never trained, and they hold the key to stronger erections, better bladder control, and even a healthier prostate? Not only that, this one group of muscles could make the difference between staying sexually active into your 80s or giving up intimacy long before you're ready. And most men over 60 have gone their entire lives without ever working them even once. After age 60, things change. Blood doesn't flow as easily. Hormones drop. Muscle strength fades. And then it starts. You can't get an erection when you want to. The urge to pee wakes you up too often at night. You hesitate to be intimate because you don't feel like the man you used to be. And maybe worst of all, you convince yourself that this is just the way it is now. But here's the part no one talks about. It's not always your testosterone, not always your circulation, and definitely not always your age. Because if you ignore these deep, core muscles, the ones connected to your prostate, your bladder, and even your confidence, the rest of your body begins to break down too. In fact, studies now link weak pelvic floor muscles to higher risks of erectile dysfunction, bladder leaks, and even early signs of prostate enlargement. Most men never find out until it's already affecting their bedroom or the bathroom. But across Europe, a quiet revolution has been happening. Some doctors haven't given up on natural solutions. They aren't just prescribing pills. They're teaching men how to regain sexual strength without a pharmacy through a simple, targeted exercise you can do completely in secret. One 68-year-old man, just like you, went from frequent leaks and incomplete erections to taking back control in just 8 weeks. It's not magic. It's not complicated. It's just something called a pelvic floor muscle routine, and the results are changing men's lives. So, what are these muscles? And why are they the key to lasting energy and intimacy after 60? Most men train their arms, their chest, their abs. But the most important muscle group you've never worked is hidden deep inside, right below your belt line. These are called the pelvic floor muscles. Picture them as a small hammock between your pubic bone and your tailbone, right underneath your bladder and prostate. They don't show up in the mirror. You can't flex them at the gym, but they make everything possible below the waist. They're the muscles that hold back urine when you cough or sneeze. They're the ones that help you finish peeing completely. Most importantly, they control blood pressure to your penis, giving you firmer erections and greater control in bed. And here's the thing. Like every other muscle in your body, if you don't use them, you lose them. By age 60, they begin to shrink. You may not feel it right away, but gradually, you start noticing more off days. Performance becomes unpredictable. You feel like your body is slipping, but you can't figure out why. Most doctors will say, try testosterone, or here, take this pill. But what they're missing is the foundation underneath it all, muscular control. In fact, one study in the British Journal of General Practice tested simple Kegel exercises, that's the name for pelvic floor training, in older men with erectile dysfunction. After just 3 months, 40% regained full function. Another 35% had significant improvement. And not one of them used medication. It wasn't their hormones. It wasn't their age. It was a muscle they had never trained. And we're just getting started. There's another surprising benefit to stronger pelvic floor muscles, and older men are finally beginning to see it: prostate health. See, this muscle group surrounds the prostate like a sling. When strong, it improves circulation, helps fight off inflammation, and can actually relieve some of the pressure that makes urination difficult. That means fewer bathroom trips at night, less urgency, stronger flow. All from a few minutes a day of the right kind of muscle work, no medications, no machines. Men who do this consistently report something else too: confidence. You've probably felt the difference. When your body performs well, you feel more in control. You're calmer, more relaxed in intimate moments, because you're not worried about what might go wrong. This kind of quiet strength doesn't come from a bottle. It comes from your body learning to work again, the way it was meant to. A 64-year-old man wrote into a pelvic therapy clinic after 6 weeks of daily Kegel practice. He said, "I thought I was done. I was embarrassed, frustrated. My doctor told me to try injections, but I just couldn't do it. My wife suggested these exercises, and at first I rolled my eyes. But I'll be honest, something started working again after just a couple weeks. I don't feel broken anymore." That's the power of training the right muscles. But when you don't, there's a darker cycle. As these muscles weaken, blood flow gets worse. Performance drops. You start avoiding intimacy. You lose touch with your partner. Loneliness grows. And you begin to accept decline not because you've aged, but because nobody told you about the one solution that actually strengthens the system from the inside out. And here's the final kicker. These muscles don't need hours in the gym. They don't need supplements or diets or tracking apps. Just 5 quiet minutes a day. No one even has to know you're doing them. You can work them on the couch, in your car, at your desk. And the payoff? Starts with your bladder, improves your performance in bed, and rebuilds the sense of youthful energy you thought was gone forever. In the next few minutes, I'm going to walk you through exactly how to find these muscles, how to train them, and the science that proves this works for men in their 60s. 70s, even 80s. But I want you to remember this. You are not past your prime. Your body is not broken. It's just waiting for you to reactivate the most overlooked muscle group in men's health. And it all starts with knowing what a real male Kegel actually is. Let's get into that next. To find the right muscles, you don't need fancy equipment. You don't even need to stand up. The easiest way is this. Next time you're using the bathroom, try stopping the flow of urine midstream. The muscles you're using to do that? Those are your pelvic floor muscles. Now, don't actually make a habit of stopping your stream. That's just a test, not the workout. But once you've felt those muscles fire, you're ready to train them anytime, anywhere. We call this a male Kegel, just like the exercises women do after childbirth, but designed to help men regain control from the inside out. It starts with a simple move. Squeeze those same muscles, like you're trying to stop yourself from peeing. Not your abs, not your thighs, not your glutes, just that deep internal squeeze. Now hold that squeeze for 3 to 5 seconds, then relax. That's 1 rep. Start with 10 reps twice a day. That's it. It may not sound like much, but remember these muscles are small. They're underused. They've been asleep for years. So when they finally wake up, even gentle daily work can trigger big changes. Some men report less urgency after just 1 week. Others notice stronger, more consistent erections after 3 to 4 weeks. One man in a Norwegian study even called it the best 5 minutes of my day because for the first time in years, he felt like he had control again. And here's the best part. You don't need to break a sweat. You don't need to go to the gym. You can do it at red lights, during commercials, even while reading a book. Because these muscles are hidden, nobody sees them move. There's no pressure, no performance, no one to impress. Just you, quietly rebuilding the foundation of your manhood. Now, over time, you can level up. After a week or 2, increase the hold to 10 seconds. Then try adding quick pulses short, sharp squeezes in between your longer holds. This combo attacks the 2 most important factors, strength and control. It's like fine-tuning the wiring between your brain and body. And just like lifting weights tones your arms, this internal strength work tones the system that controls flow, firmness, and confidence. One physical therapist for older men told a story about a 72-year-old patient. This man struggled with both incontinence and ED. He was skeptical, resistant. But his wife encouraged him to try just once a day. 12 weeks later, he said he felt 10 years younger. He said he wasn't waking up drenched in frustration anymore. He could enjoy evenings with his wife again, without anxiety, without hesitation. That's the emotional power of restoring these muscles. Your mind starts to open up again. You stop dreading bedtime. You stop planning your evenings around the nearest bathroom. You start feeling like yourself again. And all of that starts with 5 quiet minutes of focused effort. Now, let's talk about a few simple habits that make this process even more effective. First, breathe. Lots of men accidentally hold their breath during the exercise. Don't do that. Inhale gently as you relax. Exhale as you squeeze. Think of the movement like a wave, smooth, natural. Second posture. Try sitting tall or lying flat on your back. Slouched positions make the squeeze harder to control. A good posture helps your brain connect with those deep internal muscles, especially in the early stages. Third, consistency over intensity. Don't chase perfection. You're not trying to crush weights here. You're trying to build control. That takes time, but it's absolutely worth it. Because here's what can happen when this clicks. You stop needing to wake up 3 or 4 times a night. You stop grabbing tissues in the middle of intimacy to hide disappointment. You stand taller. You feel prouder. Because you didn't give up your masculinity to a pill, or a surgery, or a slow, silent decline. You built it back the way nature intended, muscle by muscle, from the core outward. Now, some men wonder, how long does it really take? It depends. Some feel spot improvements after 2 weeks. Others take 6 to 8 weeks for real, lasting change. But the curve continues. Men who've done these exercises for 6 months to a year report the greatest benefits, especially in maintaining control while aging gracefully. And the science backs it up. Researchers in Italy tracked older men with prostate issues who practiced these moves daily. The results? Improved flow, reduced urgency, better intimacy, no side effects, no risky procedures. That's the slow, steady magic of building strength from a place no one taught you to look. And here's something powerful I want you to remember. Every time you squeeze those muscles, you're not just training your body. You're making a decision. You're choosing to fight, to take back ground, to stop letting decline define your future. Because nobody told us this stuff when we were 40. Heck, most doctors still don't mention it now. But the men who act on it will quietly rise above the rest, not because of luck, but because of effort. So if you're watching this and thinking, is it too late for me? The answer, backed by science and stories, is no. It is never too late to restart strength from the inside out. And if you're ready to take the next step, we're just getting warmed up. In the next video, I'll show you exactly how to track your progress even if you can't feel the muscles working right away. Plus, I'll walk you through a powerful 3-step strategy to upgrade this simple routine into a foundation for lifelong vitality. Click the link below to get notified when that video goes live. Trust your body. Give it a reason to fight again. And let's rebuild strength where it matters most, starting today.